Hi everybody, Dr. Jamie Barney here, clinical psychologist, talking to you about all things mental health and psychology. I post videos every week with the aim to post content that you find informative and helpful. Hi guys, welcome back to my channel. In this video, I'm going to be talking about how long does therapy take. Now, spoiler alert, like many things in psychology, it's not a black and white answer. This video will help you though if you've been considering starting therapy and not sure how long it will take or what you're in for. So let's dive in. Now, to begin with, there was a really interesting research piece that was done at Griffith University up in Queensland some time ago. And this was based on clients that attended the psychology clinic there. So this is a psychology clinic that is really run by postgraduates and masters and doctoral level psychology students, so people in their final period of training, and clients can self-refer into this clinic. And so this research looked at how much treatment do people need in order to move to what they call a clinical level of recovery. So essentially what that means is that, how much therapy does someone need to move to a clinical level of severity on say, like an outcome measure like the DASS, depression, anxiety, stress scale, to a non-clinical measure, non-clinical level of severity, sorry. So if someone scores in the clinically significant range for depression and anxiety and stress, how long does it take for them to come back to a non-clinical range? And so what this study found was that only about 30% of clients that attended the clinic at Griffith were recovered after 10 sessions, and then 50% were recovered after 18 sessions, and the remaining 50%, there was quite a large number of treatment sessions that those people needed. One of the take-home messages, I guess, for that is that obviously in Australia we have, in this year we've had the number of Medicare sessions that have been reduced. It used to be 20, now it's back to 10. And so essentially what we know is that that amount of treatment is going to be insufficient for roughly about 70% of the help-seeking population. One of the things too that certainly when I did my training at Griffith was that because it was a training clinic, we would often really only take in people that were, suffering from mild levels of distress. So certainly if people had, substance use disorders or quite a severe eating disorder, suicidality, or, really more acute mental health difficulties, we'd often refer them out. So perhaps these findings, they might even be underrepresentative of the types of people that we see, certainly in the public mental health sector, but also in private practice more broadly as well. So I guess another point on that too, do pre and post measures on an outcome measure or outcome measures targeting mood or any kind of measure of symptoms really capture the complexity of the human condition. A lot of times in research settings we have to really isolate a lot of things, and I guess in practice things can be a lot more complex than that. In the same way that physical illness and injury can differ in how severe it is and also the amount and intensity of treatment that's required, I would say that the human mind and mental health and mental illness is the same thing. So some people might require multidisciplinary team, medication, hospitalization, community follow-up. Still others may do okay in a private practice setting, whether that's a short, medium or long-term treatment, and others may actually get by okay without any kind of treatment or intervention at all. So that age-old question of how long is a piece of string. I've got some colleagues overseas in America, and it's over there. It's actually not uncommon for people to have weekly therapy for at least one, if not several years. So folks over in America are getting a treatment dose at a much higher rate, psychological treatment than what we do here in Australia, where accessibility can be an issue for a lot of people, and so. More and more, I think what's more helpful than a number-based answer to this question of how long does therapy take is more around, what are the problems that brought you into therapy? What were the difficulties in the first place? And to what measure have they been resolved? And so thinking about that, what were the goals that you set out for yourself in therapy or created during therapy, and how close to them are you? Sometimes being able to identify psychological problems can be quite easy. There's a clear problem, a clear trigger, and the pathway forward can seem quite straightforward, and there can be a lot of protective factors. So thinking about a hypothetical example, someone suffering with low mood, irritability, sleep difficulties, loss of appetite, libido, panic attacks that started really when a relationship broke down, no other psychological difficulties before that time, this person has good social support, no financial difficulties, came from a home where both parents were emotionally supportive and available, always well connected in school, did well academically, and no history of bullying or anything like that. And so with a case like that, maybe the treatment pathway could be around helping them resolve their feelings around the breakup. And if that's done well, there's every chance they could go on functioning just as they were before, or maybe even a little bit better. Another example could be someone who came into therapy really uncertain as to what the difficulties that she was struggling with. In session, she quickly loses her focus, oscillating between a dissociated state or becoming quite distressed and overwhelmed. Really hard to get much out of this client in the way of a history. There's a pattern of substance abuse, though she's still managing to hold down a job, but underperforming in that job. She suffers from frequent panic attacks that seem to come out of nowhere, and try as you might in therapy, there hasn't really been able to discover any discernible trigger to these panic attacks. This person doesn't seem to have any solid friends or supports, and every time she talks about colleagues, acquaintances, or anyone in her life, there's themes of paranoia and judgment, lots of ideas that they're out to get her, and engaging in some form of character assassination. There is a history of sexual and physical abuse from extended family members, and the parents never knew about this until this client was well into her adult years. The father was absent, quite a successful businessman, but would often be overseas working, had multiple affairs that everyone knew about, but no one mentioned anything. And her mother had a chronic health condition and was bedridden for lengthy periods of time, resulting in her having to stay with these extended family members who were the perpetrators of the physical and sexual abuse. So those two very different hypothetical examples that I've listed above, if you ask me how long it would take to treat either one of those clients, hand on heart, I couldn't tell you. What I would be aiming to do, though, with either one of those clients or anyone else that came to see me was to co-create between myself and client a shared understanding of the problem. So not just a diagnostic label, depression, anxiety, trauma, borderline personality disorder, but something that's deeper than that, something that actually sort of resonates at a felt level. So something like, there's this sense of inadequacy that follows you around everywhere, that causes you to function way beneath your potential, feel distant and detached from your friends, from yourself, engage in superficial relationships, leading you to feel as though life is not worth living. And then when there's this shared understanding as to what some of the nature of the difficulties are, coming up with the goals of therapy. So what about we see if we can get to the root cause of where this inadequacy comes from, see if we can work through whatever conflicts and unresolved feelings that are causing that to happen in your everyday life, so that you can have richer relationships with others, find out what your true potential really is, and live a life for yourself that actually feels like it's worth living for. And thinking about, what are the tasks that we can engage in therapy to sort of take us closer towards those goals. So in here, during our sessions, how about staying connected to what happens in your body as we're talking, and let me know any time that we're talking about something that brings up this sense of inadequacy. When does it get activated in here? Anything that we do that makes it feel worse, and anything as well that makes it feel better. What I found is that when there's agreement between myself and the client between what the problems are, what the nature of the difficulties are going on in the client's life, their goals for treatment, what they're hoping to get out of therapy, and what we're doing in therapy makes sense to them in order to help them further along the way, treatment tends to move forward in a positive direction. If there isn't that consensus or agreement between client and therapist, or if neither one are sure what's going on, treatment can become stalled, reach an impasse, or feel like it's going around in circles. So we know that some clients can get there in 10 sessions in terms of how long does it take for people to get better in therapy. Most need more than 10 sessions. That's what I've experienced. It's what all my colleagues have found as well. We do know that therapy is effective, very beneficial and helpful for most people. There is research that suggests at least a correlation between treatment dose and outcome. That is, those that have more therapy do tend to get more relief than those who have less therapy. That's assuming, though, that the therapy is targeting the things that you need it to and taking you closer towards your goals. So I think that what's more important than how many therapy sessions you've had is the therapy helping me understand myself in a deeper way? Is it helping me to improve my quality of life, my relationships with myself and others? Is it helping to reduce my distress? And is it taking me closer towards my goals? These would be the questions that I'd be asking myself if I was in therapy, but also it's the questions that I ask my clients to reflect on too when we're talking about how is their therapy going, what's going well, what's not going well, and how can we keep making things better for them. So as I mentioned, not a black and white answer, but hopefully it does give some sort of clarity and ideas, not only as to treatment length, but also kind of how to make the most of the therapy sessions and how to tell if it's on track or off track as well. Thank you so much for watching. If you like watching these videos, as always, please feel free to like, comment and subscribe to my channel. If you have any questions or comments about anything that you'd like me to post about in future, please let me know as well. And look forward to seeing you all in the next video. Bye for now.